Hello, everyone, and welcome to the Spring 2023 Semi-Annual Medicaid Fair. Thank you for joining the session, Georgia Medicaid Waiver Project Pathways Overview. I am Jessica Bowen, Provider Relations Field Services Representative, and your host for today is Ms. Anika, Eligibility Policy Manager with Georgia Department of Community Health. We hope to provide you with some very valuable information today regarding this program, which will be soon implemented. Ms. Anika.
Thank you, Jessica, and good afternoon, everyone. Again, my name is Anika Washington. I'm with the Georgia Department of Community Health, and I'm the Eligibility Policy Manager, and we will be going over the Pathways implementation project. The overview. So, Pathways is a new Medicaid program that will give low income Georgians who are not eligible for Medicaid today a new opportunity to gain access to health care coverage through Medicaid. Georgia residents can apply for this program starting on July 1, 2023 of this year. Pathways is designed for adults who meet the following eligibility criteria between the ages of 19 and 64, have household income up to 100% of the federal poverty level, not eligible for any other categories of Medicaid, and completing at least 80 hours per month of qualifying activities. And we will discuss what those qualifying activities are. Now, Pathways is different from other states with work requirements because it expands access to health coverage for those engaging in qualifying activities and does not impose new requirements on those currently eligible for Medicaid. The Pathways benefit package includes almost all of the services currently covered in traditional Medicaid, which includes doctor visits, hospital stays, emergency services, prescriptions, laboratory and x-rays, family planning services, home health services, preventative and wellness services, as well as chronic disease management services. Now we'll discuss the qualifying activities and reporting requirements associated with the Pathways program. As stated, Pathways applicants will need to attest and verify they are completing at least 80 hours per month at application of qualifying activities to be eligible for Pathways. In order to continue Pathways coverage, Pathway participants will need to report monthly and continue to engage in 80 hours per month of activities. Members can engage in more than one type of activity to get a total of 80 hours per month. So you can do multiple types of activities in order to reach your 80 hours per month. So employment, which also includes self-employment or on-the-job training, job readiness assistance, community service, vocational education, enrollment in an institution of higher learning, or participating with the Georgia Vocational Rehabilitation Agency. Reasonable modifications are available for Pathways applicants and members who indicate they have a disability that prevent them from being able to engage in a qualifying activity. Pathways enrollment is prospective. So if you apply for Pathways on July 1st, the earliest that you could become eligible for Pathways coverage is August the 1st. And with that, you will have to, at application, report your qualifying activity and hours. If a Pathway participant has a reason they cannot complete the 80 hours in a month, they can request a good cause exception for missing hours. Good cause exception reasons include a temporary illness or injury, family emergency or life event, birth, adoption, foster placement, or death of an immediate family member, serious illness or hospitalization of members or immediate family member, natural or human-caused disasters, temporary homelessness, as well as COVID-19. Now, through each certification period, and a certification period is 1 year, Pathway participants will have 120 good cause hours available. Note that good cause hours are only available once enrolled in Pathways and not at application. So During the year that you're currently enrolled in Pathways, if you have any of these illnesses, you have up to 120 hours of the good cause hours that are available for your use so that you can continue with your medical coverage. Once enrolled, members can maintain their health coverage by reporting and verifying that they're completing 80 hours or more per month of qualifying activity hours by uploading a pay stub or other documentation. There will be different ways that you can report your other qualifying activities. If you're enrolled in higher education, we can use your hours from school to help you meet your qualifying activity for the month. Reporting and verifying is due by the 3rd of the next month. So for January hours, members must report and prove them by February the 3rd. Late reporting occurs on the 17th. Failure to report by the 17th of the month could result in the suspension of your pathway coverage. So here, application is submitted on 7/1. You apply for medical assistance, and an eligibility determination is made for Pathways, and we will send a notice. You're determined eligible as of 8/15. The earliest your coverage can start is September the 1st. So when September the 1st comes, you will need to report your August hours by September the 3rd in order to continue with your coverage. September hours should be reported by October the 3rd, and then October's hours should be reported by November the 3rd. If members do not demonstrate their hours by the 17th of the month, they will be suspended and will not receive coverage for that month. They will continue in suspension status for up to 90 days until they report a completion of 80 hours, at which point your Pathways coverage is reinstated prospectively. So if you did not report hours for September and you did not report hours for October by December the 1st, or November hours, this should be January 3rd, but the December hours are reported by February the 3rd, then your coverage will be reinstated as of February. So for the implementation of Pathways, we will have a phased approach. So July 1st, 2023, we will begin with the pathway eligibility, qualifying activities and reporting, and allowing good cause. Phase 2 will be the mandatory HIP and automated program audits. With the mandatory HIP program, any member who is working and is eligible to receive employer-sponsored health insurance, they will have their premiums, co-payments, as well as their co-insurances covered by Georgia Medicaid if cost effective. Phase 3 of the Pathways project is premium, co-pays, and member reward accounts. Members with income between 50 and 100% of the federal poverty level will be required to pay a premium, as well as copay. And then there will be a member rewards account available for healthy activities. Those funds will be used to pay co-pays and premiums as well. Now, to the support members in the Pathways project, our CMOs will be engaging our members to help them stay compliant with meeting the requirements of the program and to maintain their coverage. CMO support will include providing communication to newly enrolled Pathway participants in Pathway programs, providing personal support to members to understand the program so that they are aware of what is required of them and how to meet those requirements, as well as providing information on how to enroll in individual market health insurance coverage or Medicare when they are no longer meeting Pathways eligibility requirements. DCH is preparing material and resources ahead of Phase 1 to provide applicant, members, and stakeholders, which includes Pathways program website information, FAQs covering essential information for applicants and new members, information sheets with simple, straightforward information on the program, and how-to guides to explain reporting. Materials will be available shortly to stakeholders and organizers and providers throughout the state to support potential and enrolled pathway participants. Now, for the Q&A section, if there are any questions, please place them in the Q&A box for our review, and we will provide those responses at a later time.
So the Q&A box should be at the top on your main menu items across the top dashboard. If your screen is condensed, you might have to click more or click on the three dots that says more or more actions. Hi, Miss Green. I see you have your hand up. Did you have a question?
Yes, ma'am. I was wondering, is this something we're gonna have to contract with in order to bill for it, or is it just another category of service for Medicaid?
Did you hear it? I'm sorry.
I'm
Can
sorry,
you
I was just
repeat your
wondering,
question, please?
okay, is this pathway, is it like commercial insurance, or is it something we're gonna have to contract with as a Medicaid provider, or is it just another category of service that we can bill for?
It's another form of Medicaid, and you should be able to bill for it normally as you would another Medicaid member.
Okay. So we don't have to do any type of new providers numbers with them, just bill as we normally do for DSPS or health check or
That is
family
correct.
planning. Okay. Okay, thank you.
You're welcome.
So because we do have a little bit of extra time today, we are going to take the time out to read aloud some of your questions or to allow some of you to ask some of your questions and respond to them today. Any questions that we are unable to get to, again, we will capture them and jot them down to be responded to at a later time, but they will be responded to. Just make sure you include your name and contact information such as email address and or phone number. Mr. Ralph O'Connor, do you have a question?
Yes, I was wondering, are there other states that have done something similar to this, and what's their experience been? Seems like it's a burden for the members, and it's going to be a burden for DCH or Gainwell having to process all this stuff monthly.
My apologies. Will you repeat your question, please?
Sure. My question is,
We got to
are there
switch
any
back
other
and forth with
states
the
that have this
volume.
type of
I forgot to
Medicaid
turn the camera
expansion?
on.
And it just seems like it'll be a lot more work for y'all, and the people that I work with that are low income have a challenge updating their eligibility yearly. And this has got monthly eligibility and monthly premium requirements, if I understood what you said. So I'm just wondering what others' experience has been with something like this. Thanks.
Georgia's program is unique in itself, so we'll be all embarking on this new endeavor together. With regards to the reporting, it will not be handled by Gainwell. This will be through the defects worker, as well as the member will have an ability to report their hours through multiple modalities, including directly on Georgia Gateway, which a lot of them currently use for their Medicaid, SNAP, or TANF renewals. And the certification is yearly for this program, similar to all our other Medicaid programs. Good afternoon. So I reviewed the questions in the Q&A, and a lot of them are specific to services provided, and we will provide a written response to those questions at a later time. Thank you, everyone, for participating in this presentation, and I hope you have a great day.